Hi, this is Callum. This is going to be a really quick video where we go over the seminal vesicle histology. So this is a section through the seminal vesicle, which was taken as part of a radical prostatectomy specimen for prostate adenocarcinoma. They always take out the seminal vesicles, and invasion of the seminal vesicles upstages tumors. So we always look at it closely to see if there's any adenocarcinoma within the seminal vesicle. This is a section through what is, I'm sure, the left seminal vesicle. Now, there's no difference in the appearance histologically, but I can tell that because there's blue ink on the surface. And by convention, we ink the left side blue because blue has an L in it. And we ink the right side green because green has an R in it. So this is probably the left seminal vesicle. This, at low power, the seminal vesicle, illustrates really nicely a point I was trying to make in the previous video about the organoid architecture that we can see in some tissue types, and it can be really helpful. So this has got an organoid architecture, by which I mean this is a gland, and it's got a glandular architecture where you've got. If we look at this particular area, we've got glands arranged around the outside, all emptying into a central duct. This is a really well-defined little lobule of glands, and that's replicated throughout here. The seminal vesicle. There's another one. There's another one. There's another one. This is a bigger one. I mean, these are all connected and all opening into the same duct to discharge the seminal vesicle product, and they all have the same appearance where you've got glands around the outside, all opening into a central sort of duct system. It's almost got a tree line like architecture, or an organoid architecture where it's all organized, whereas the architecture, if it would be infiltrated with adenocarcinoma, it would be haphazard and it would just be infiltrating all over the place. So at low power, even without looking at these cells, I can tell that this is a normal seminal vesicle. So if we zoom in a bit closer at the glands themselves, the seminal vesicle has a pseudostratified lining, which we've come across before in these videos, and this illustrates quite nicely. It looks like these are stratified. There's cells on top of cells on top of cells, but it's actually pseudostratified. So all of these cells will connect with the basement membrane. It's just that they're heaped up on top of each other, giving that stratified look. But they're not really. These are pseudostratified. And these nuclei, characteristically, nuclei are the purple bits. They're taking up purple splodges that are taking up hematoxylin. And the cytoplasm has that slightly pinkish purplish hue that's a bit lighter. So these nuclei, if you look at that nucleus and then compare it with that nucleus, which is much bigger. It's right next to a much smaller nucleus. And that's replicated throughout. If I look around, you'll see quite big nuclei of different sizes and shapes next to much smaller ones. So that's what we call nuclear pleomorphism, where the nuclei are all different sizes and shapes. And they're actually quite haphazardly arranged throughout the cell cytoplasm as well. It can make it look quite jumbled. But if you remember, this has still got the organoid architecture. These are still nicely arranged glands when we look at low power. But when we zoom right in, there's nuclear pleomorphism. Now, nuclear pleomorphism in some situations, look at that huge nucleus there. In some situations, if you saw this appearance, you'd be very worried that this was at least a dysplasia, if not adenocarcinoma. However, in this situation, we know that we're in the seminal vesicle, and that's normal. That's a normal degree of nuclear pleomorphism, and we can be reassured by that. Sometimes it's difficult to know if you've got a biopsy or a small, if it's part of a prostate section, whether you're looking at prostate or whether you're looking at seminal vesicle. And an easy tell, apart from the fact that this has got the nuclear pleomorphism, is this golden lipofuscin pigment that you get within the seminal vesicle. It's golden pigment within the cytoplasm of the cells, which is not present in prostatic glands, and that's an easy tell that you're in seminal vesicle. So it's a bit funny, seminal vesicle. Most epithelial structures within the body don't have that degree of nuclear pleomorphism, and to the untrained eye can be a bit worrying. But when you know where you are, you know the other things to look for. then you can be reassured that that's just normal seminal vesicle. Okay, let's move on. Speak to you soon.